Everyone with Down syndrome is a positive contributor to society.
Our genes make us who we are.
My life is a point.
We are showing the world our talents.
Give him a hug.
Research allows us to live our lives to our fullest.
As a blueprint, we can actually help people.
Global has been on the forefront of medical care and research for Down syndrome.
So when I was 19 weeks pregnant, I got a prenatal diagnosis that my first child, Sophia, would have Down syndrome. I'm a little bit of a type A personality, so right after Sophia was born, I flew to Bethesda and met with the head of the National Institutes of Health. The director, Elias Zerhouni, told me that Down syndrome was the least funded genetic condition at the National Institutes of Health. He said to me, if you're gonna do one thing that's really gonna change the lives of these children and adults, create an institute of research in medical care. One for Down syndrome doesn't exist. A lot of other conditions and diseases have it. You don't. Go do it.
That was the beginning. We knew at that time that we would be on this journey.
For a scientist interested in genetics, this is a truly fascinating area of research. People with Down syndrome are truly remarkable in terms of their genetic makeup. They live every day with an extra chromosome. They have one more chromosome than the rest of us. And that extra chromosome affects them in a number of ways. How they are, for example, protected from cancer, but predisposed to Alzheimer's disease.
We found that there was hardly any research being funded by the federal government, so we wanted to create a center that encompasses basic research and clinical care.
This was an opportunity to really give us the ability to go beyond the basic understanding of the molecules of life to make people's lives better.
You know, for Global, that's how we got on this path in establishing these different affiliates to focus on different areas. Advocacy, education, outreach, science and research, pediatric medical care, adult medical care, and Alzheimer's.
We were very fortunate to partner with the C family to create the C Center. It is a vibrant part of Children's Hospital Colorado.
The Cernic Institute has become a major player in basic biomedical research and clinical research.
Our goal is to develop new treatments for people with Down syndrome and people with Alzheimer's disease.
The work of the Global Down Syndrome Foundation has really changed the landscape. Not only the research landscape, but also the social aspects and the advocacy aspects. They thought not only we need to attract scientists, but we also need to convince the government that funding into this condition is necessary.
We did a lot of groundwork. We brought Congress people and scientists and NIH together. I mean, we were in DC probably every month.
The hearing in 2017 was a huge turning point.
Our children and adults with Down syndrome deserve to know that there is research funding and medical care available to them that allows them to reach their true potential.
And it won't just help those with Down syndrome, but also millions of others with life-threatening diseases.
Our lives are worth living.
That hearing led to the first significant increase in Down syndrome research funding at NIH.
So this year, 2018, we will increase funding by 65%.
You have captured the attention of the panel. I think we're going to do everything we can.
Because people with Down syndrome have a radically different disease spectrum, the only way we're going to succeed is with a trans NIH program for Down syndrome research.
This important work should not be siloed in a single NIH institute.
Include is that trans NIH Down syndrome research program.
Colorado is home to internationally recognized experts and fierce advocates like Global, University of Colorado, and the C family.
As parents of a child with Down syndrome, my wife Jody and I are forever grateful to all of you at the Global Down Syndrome Foundation for the great work that you do on behalf of our son Isaac and all of those living with Down syndrome.
The recent increase in NIH funding is revolutionary. It's a game changer. Now it is possible for scientists to think big.
Having a better understanding of the genetic underpinnings really will change our practice because we're going to be able to create better treatment interventions.
Other recent successes at the Cernic Institute are the establishment of the NIH National Data Coordinating Center, launching the first clinical trial to treat autoimmune skin conditions. And the NIH has just granted $4.6 million to our lead Alzheimer's scientist to study whether a new drug will improve cognition in young adults with Down syndrome.
We discovered leucine juices up the immune system to repair the brain in people with Alzheimer's disease and may be able to do the same thing for people with Down syndrome.
I've been having a medical emergency with Megan, and I didn't know where to go, didn't know where to turn. Global immediately dropped everything and helped us out.
I think we've helped to extend the quality of life and also the lifespan of people with Down syndrome.
My mission has always been to try to improve therapeutic intervention and be involved in clinical research to make a difference for these kids and individuals down the road.
We've also grown from having a couple general clinics to having, clinics every day.
Last year, Global published the first ever evidence-based medical care guidelines for adults with Down syndrome.
To have all that information available in one place is amazingly helpful.
Here at the Down Syndrome Association of West Michigan, we just wanted to say thank you to Global.
Gray Science has been blessed with having Global as a partner.
Thank you so much, Global Down Syndrome Foundation, for your grants this year.
Last year, we lost a lot of people to COVID, but we also lost our first Quincy Jones Exceptional Advocacy Award winner and Ambassador Deandra Dixon. Even within Down syndrome, there are so many neglected areas. One such area is African American research. We've started a fund that we are actively looking for matching grants for to address this terrible disparity.
So it's very important for the research, particularly for African Americans.
I'm sure you would all agree that a lifespan of 60, 18 years less than average, is not okay. That multiple medical issues between the ages of 40 to 60 is not okay. With your help and support, we can ensure that the first generation of people with Down syndrome to outlive their parents can be safe, healthy, happy, and fulfilled.
We're here to stay, and we're not going anywhere.
Thank you for supporting me.
Please support Global.
Research.
Support Global.
Bigger, fuller, richer lives. What could possibly be better than that?